First of all, just to let you know that I am the head of unit of one of the two units dealing with health research in the DGRTD. My unit is called Health Innovations and Ecosystems, and the other unit in DG Research dealing with health is focused on combating diseases. So yes, so that you see that we are to programming health related in Horizon Europe. Of course, we do it, especially more and more, and especially since the start of Horizon Europe, in full co-creation with other relevant DGs. So this is very important to keep in mind, because as we want one of the main mottos, and maybe we can go to the first slide, otherwise I'm already entering into the matter. But of course, I will talk to you about Horizon Europe, the Research and Innovation Framework Program of the European Commission. General objective: strengthen the scientific and technological basis of the Union, fostering its competitiveness to deliver on political priorities. You already named a lot about the digitalization, digital decade, but also the Green Deal, because we want to contribute to tackling global challenges, including sustainable development goals and climate objectives. I am listening to an echo. I don't know if maybe there are
I don't know. I'll turn off my but I don't think.
I don't know what is, but there is a kind of echo when I talk in. All right, so let's go like that. So we can move to the next slide. Because as I was mentioning, one of the most important maybe novelties of Horizon as compared its predecessor is the impact. We are searching for achieving more impact with from the research results that of the projects that we are funding. Because we have realized, and I'm not just us, it's a general fact that Europe is very good in creating knowledge, but it's much less good, if I can say, in translate that knowledge into benefits for the society. And that's why this is one of the main modus operandi of Horizon, try to really put the focus on the impact. Maybe to mention that what are the novelties is the missions. I'm sure you have heard about the mission of Cancer, is the creation of the European Innovation Council to support breakthrough innovation, but also to support a lot SMEs in their competitiveness. And then another very important novelty in the context of this discussion is that Horizon Europe will be looking for more synergies with other EU funding programs to encourage faster uptake at national and regional level of research and innovation results. Also synergies with other EU policies, and that's why I was mentioning on the co-creation, because we want to increase the role of research and innovation in overall policy making. And that's why it is very important to co-create, to discuss with the other DGs to see what are the main needs for evidence in the context of legislative process, in the context of policy decision making. So we can move to the next slide. So there we see the structure of Horizon Europe, 3 pillars, that is very similar to the predecessor. We will focus on cluster 1, on health, which is part of pillar 2, and which is tackling global challenges. Pillar 2 is tackling global challenges and the European industry and competitiveness. So cluster 2, fully dedicated to health with a budget of 8.2 billion euros, is responding to the challenges that the demographic change represents for healthcare, but also to the need of greater resilience and equity in healthcare systems, as COVID crisis has proven, has already been mentioned quite a lot this morning. Of course, research and innovation, we believe, has an important role to tackle those challenges by advancing knowledge and capabilities, by improving the understanding of health and disease, and by developing innovative methodological and technological solutions to better manage health and disease. Also to design sustainable approach for the digital transformation. That's, as I told you, is one of the main political priorities, and Horizon Europe has specific targets to support digital in the same way that it has to support green. So what is new in cluster 1 as compared to societal challenge 1 in Horizon 2020? I would say that the digitalization and personalization of healthcare are horizontal, are cutting across all intervention areas. A lot of focus, as I mentioned, in impact, so much increased focus on health economics, for example, and regulatory science. patient-centered solutions and technologies for health and care, for integrated approach, much more also evident and explicit. And then increased focus on healthcare systems and on environment and health. So these two areas have been allocated out of the 6 destinations that you will see in the next slide, and we can go to it. They have a specific area dealing with either the challenges of the healthcare systems or the impact of environment into our health. Yes, you can click 6 times because we are not going through each of the destinations here. We are going just to mention that this is the way that the research around health and care has been structured, at least for the first strategic plan that will cover from 21 to 24. And these destinations will be implemented mainly through grants to collaborative projects in multi-country, but also grants to contracting authorities with the support of pre-commercial procurement and public procurement and innovation, and also through partnerships, co-funds with member states or with the industry. So we are going to focus mainly on the last 3 destinations that are maybe the most relevant to you. So we can move to the next slides, where it's targeting the destination 4. The destination 4 has a main focus on healthcare systems that are under severe stress, as we all know, due to many factors, not only demographic change, but also social inequalities, political uncertainties, climate and environmental changes that also represents particular challenges. And as was already said by Katrina, the health workforce shortage that are a major concern in many countries. This was already very evident before COVID crisis, and that's why a full destination was dedicated to precisely to this matter, to the need of the transformation of healthcare systems. And the priority that was identified was to contribute to make them more accessible, cost-effective, resilient, sustainable, and trusted, as well as to reduce inequalities. So this area will focus on the strategic research agenda of the transformation, with a particular focus on creating pipelines from research to implementation to find new ways to bring innovation to the systems while keeping them sustainable. Very, very important. So we can move to the next slides, where you will see the topics that we have funded in 2021. And of course, today I can only talk to you about 21 and 22. We are fully immersed in the preparation of the work program of 23 and 24 that we expect to have adopted by the end of the year. So in 21, these 3 topics were funded by this destination. The projects funded are starting now, either in June or after the summer. And we can move to next slide, where I'm going to give you maybe a little bit of more detail of some of these topics, of all these topics. By the way, of these destinations, you see here the 4 projects that have been funded in the context of enhancing quality of care and patient safety. These are projects around 5 million euro each, and I would say that around 10 beneficiaries, between 7 and 12 beneficiaries, I think, in most of the projects. Let me maybe mention the 2 that have already started at the beginning of June. Is the Safe Polymed, that is addressing the safety in polypharmacy. Very, very interesting project dealing with adverse drug reactions that are among the leading causes of death and a major cause of hospitalization. So this project will develop an innovative framework to define and manage the drug-drug gene interactions, both for physicians, but also with the aim to empower patients. Validation will be included of the developed safety tools in a proof of principle study that include representative patient cohorts from different European clinical sites. Another interesting project addressing safety is the one, the last one of the slide, which is called Safest. One particularly, well, it is addressing surgical adverse events, also very important cause of complication, so representing also a huge cost for the healthcare systems. And an important aspect of this project is that it will have an increased focus on the impact and uptake, even more than the others. We can move to the next slide. where you will see also, I was mentioning about the political priorities, and this particular topic is addressing two of them. Priority on cancer with the Beating Cancer Action Plan, but also the European Health Data Space. So this topic is supported to contribute to both political priorities, developing data-driven decision support tools for better healthcare delivery and policy making with a focus on cancer. 5 projects, bigger projects around 9 to 10 million euros. Maybe let me give you an example that I found quite relevant, especially in the context of what you were saying around the data and how to not to be afraid of the data. And I think the GDI clinics, which is the second one that you see in the slide, can address precisely that issue, because it's aiming to improve personalized medicine in oncology by optimizing genomic data interpretation. So after sequencing of genome and before advising on compatible targeted therapies, is targeting the bottleneck, which is the interpretation. So this project will aim to systematize the interpretation process by integrating relevant databases in a kind of one-stop shop tool, with the possibility to organize virtual molecular tumor boards co-facilitated by reference hospitals. This project will include validation through pilots in the 9 clinical partners, but also replication in 30 hospitals across Europe. And I also find quite interesting the project Strong AYA, the fourth in the slide, Strong AYA, that is dealing with adolescents and young adults with cancer that are facing very specific issues like infertility, unemployment, financial problems, difficult to get insurance, for example, and with very scarce specific healthcare services addressing their specific needs. We can move to the next slides, where you will see the last topic that was funded in 21, which is coordination on support action, that is aiming to widen the use of innovation procurement. That could be quite relevant for you. So innovation procurement is an instrument that we are funding already since a long time, addressing mainly the demand-driven innovation, so supporting needs of healthcare procurers. But we have seen that this instrument has been quite successfully used in several regions in Europe, where there is a lot of interest and a lot of knowledge and capacities developed already. I can mention regions on Spain, Sweden, Denmark, the UK, but we would really like to widen the use of this instrument, and that's why we have put forward this coordination and support action that already started in June, and is precisely aiming to also support not experienced procurers. We can move quickly to destination 5. That will be, first of all, you've seen these slides, that the 4 topics that are being funded in destination 4 in 22. Not much to say, because they are currently being evaluated. We can move to the next one, so that you see quickly destination 5, destination that will be mainly targeting the health technologies and tools, not only digital, also biotech tools, which can be quite essential to resolve some of the challenges that the healthcare sector is facing. So what will be the main aim? To design, develop, deliver, and implement suitable, trustable, safe, and cost-effective tools and technologies for these sectors. So in next slides, you see the 3 topics that were funded in 2021. Projects are starting now, as I said, as for the other, either in June or after the summer. As you see, there are topics addressing data, in particular data how to support the innovative tools of the innovative use of health data. In particular, we are looking to unstructured data, and also to support the building of the European health data space. We are also supporting advanced therapies in the second topic that you see in the slide. But let me give you more information on the first topic. We can move to the next slide. That is addressing smart medical devices and their surgical implantation for use in resource-constrained settings, where 3 projects are being funded with a budget of around 5 million euros. maybe just mention Telegraph, that is involving 11 beneficiaries, and it's addressing the chronic kidney disease affecting 10% of the worldwide population, where millions of people die each year because they do not have access to treatment. And also, this particular project will address the issue of the complication that the currently used arteriovenous graft is causing a huge amount of failures, 70% of failures in the first year. So this will be the focus of this project, developing a groundbreaking new arteriovenous graft that will avoid the main problems of the current state of art, including also diagnostic tools to monitor and prevent device complications. This is just to give you an idea of the kind of projects. We can move to slide 15, where you will see the topics that will be funded. 3 topics, again, in 22, currently in evaluation. A lot of focus, as you see, in personalized medicine, and also trying to develop this kind of research that would be probably more difficult to have funded by the private, but by research private funders, like, for example, in the first topics, aiming to optimize the effectiveness in patients of existing prescription drugs for major diseases. I move quickly because we are running out of time on destination 6. So next slide, that is mainly tackling the competitiveness of the health industry to support the quicker translation of the research result, as I mentioned, an important aim of Horizon Europe. So we are looking also to regulatory science, how to support regulators, how to support the specific needs of a scale up of SMEs and the uptake of solutions at local level. So if we move to the next slides, you will see the 3 topics that we are supporting in 2021. Maybe I will just give you information. We can move to the next slide on the last of the topics, which is the coordination and support action, aiming to develop a trusted mHealth label in Europe. So we really want to support healthcare authorities and healthcare providers in order to really increase the use of mHealth, but also to embed the mHealth in the healthcare provision by, for example, being able to ensure that physicians can use the data and can follow and monitor the use of these apps by the patients. So it started already last month with 14 beneficiaries. And then last 5 topics, next slide. Well, in next slide and the following one, because I split it in 2 slides. Those will be the topics that will be funded in 2022. Again, currently in evaluation. As you see, a lot of diverse focus, like in cybersecurity or in new pricing and payment models for cost-effective and affordable health innovation. Very important, again, to consider health economics, but also to consider equity and affordability of as much as possible of European citizens. So as we see and compared to the past, our topics in general are being much broader and considering much more elements that are essential in order to ensure impact. And I think I will finish now. In the last slides, you have just more information about how to follow the projects we are funding, our work program when we are coming out with topics, and so that you keep engaged with us. But I know you are doing it. But anyway, just so as a summary of the different information that is available on the different sites. And thanks a lot. And of course, happy to continue engaging with you in other occasions or to answer questions, if any.
Thank you very much.
Thank you.
Okay,
I had so many screens, so many things are going on behind the presentations you cannot imagine. But thank you very much, Carmen. Very interesting, and I think, I mean, you will be on board with us, because I think it's very I got some notes from your presentation. You were talking about data, you were talking about replicability. And as Christopher said, that many times our Horizon 20 in that time, projects that were replicable from the territorial perspective in our area, because the main difference, there are many differences, but one of the main differences between Interreg and Horizon Europe is this territorial dimension. This is specificity of the area. But you are doing the first part, and maybe some of the Interreg programs could get what has been already done from your side and implement, replicate in our area. And of course, you mentioned also this innovation procurement, which when we spoke on the phone, was very interesting for Interreg programs. So I don't know if there are any question.
I think Catriona has the.
Sorry.
Yes.
Hi. Thank you very much, Carmen. That was really fascinating. Yeah, I could feel the part of my brain opening up where I used to talk about this kind of stuff in detail a lot. I think one of the things that I noticed, again, just to give you a perspective of where evidence is meeting evidence, one of the big issues that arose for us with the patient mobility study was that the perception of safety, and particularly peri-operative safety, was a major factor in whether patients chose to travel for care or not to another country. So actually, that's very interesting. And I know also because I personally have worked in the actual clinical risk area, so I also know how important those kind of preventable issues are. But that's a very interesting project. So the safest project is a very interesting one for me, but also very relevant for that idea of perception of a standardized care experience and care quality for the patient. And then the other thing, it's more a remark, I suppose, just to pick up on your issue about, how well Horizon is supporting, data-driven approaches to stratification of medicine and all of that as well. I also think there's probably an area for Horizon, and it's slightly outside of your healthcare focus. It's halfway between your healthcare focus and your territorial studies focus. So your geographers and your healthcare people. For us, one of the big central recommendations was to be able to combine healthcare system performance data and population health data, so data on the needs of populations in border territories, which is an area that we've recommended that data collaboratives be established in 4 case study regions in Europe. Those collaboratives are going to need some kind of support. Now, initially, it might just be a technical setup through Interreg, for example, in those regions. But there's definitely room for looking at those kind of cross-disciplinary territorial mapping approaches in a deeper research context and an R&D context. For maybe partners who might be interested in applying to Horizon for that kind of deeper longitudinal work, because I suppose I'll be quiet in a second, but there's something very important about being able to actually map how well our mechanisms across Europe are being used to meet the needs. So for example, we were unable to get population health for a lot of the case study regions that we studied. We weren't able to get the civic authorities or the public health authorities to really engage with us and give us a real picture of what the population health profile was for that border region. But in that, then you'd start to have those kind of indicators for the kind of investments in clinical innovation that you need. So how many people do you have, for example, with diabetes type 1, diabetes type 2? How many patients with rare diseases do you have? I know, for example, I live in a border region where we have very high prevalence of 3 quite, not necessarily rare diseases, but the population here has a very high prevalence of multiple sclerosis and rheumatoid arthritis and celiac. Secondly, we have very high levels of hemochromatosis. So that's a condition where there's too much iron in the blood, and it's a genetic condition, and it's in the population here. So we actually have companies that are developing specialist hemochromatosis treatment and diagnostics that are based in our region, that are testing their stuff on our population, but they're selling the stuff globally. And then the third thing is that we have is a condition called amyloid carditis, which is a rare cardiac disease. Again, it's epidemiological. So it's about understanding how the population in a region can also be the key to that really, really high level clinical innovation, the technology, and that whole impact on border regional economies of that kind of med tech approach. So it's not just about making making your staff go further when you've got one community nurse instead of 10. It's also about saying, well, what does a medical school bring? What does all of this research being based in a region bring to the economy of a border region? So I think that's a really interesting area for Horizon as well. And I'd be more than happy to speak to you about it anytime if I can be of use to help unpick some issues. So that's it. I'm going to be quiet now and let everybody else talk.
Thank you. I don't know, Carmen, you want to reply? If not, we are a bit short of time. We have still
I just wanted to say two things. Yes, thanks a lot, Katrina, for this information, and yes, of course, would be happy to exchange with you on that. I wanted to say that for us, it would be really, really very good to have information from you on the projects, whether the Horizon 2020, Horizon Europe, even FP7, that are afterwards being somehow replicated through your program. This would be really very, very important because we don't have that information. And actually, this is one of our main problems, that we do fund projects, we follow them where they are implemented, but afterwards there is a kind of black hole. And sometimes there are coordinators that are coming back to us indicating about further results, further uptake, further, but most of the time we don't have yet tools that allow us to see exactly what is happening with our projects once they are ended. So if we could at least know what is happening through your program, really would be super interesting for us. So definitely we have to keep the channel of communication, and we are happy to be even involved directly in some of your events or discussing with your beneficiaries. Also on innovation procurement, if you are interested about that, because I think really it would be very interesting for your communities. And I can say that these are the less oversubscribed topics. Most of the time our topics are really super oversubscribed, and it's quite difficult to get grants. You have to really fight a lot. Whereas in the case of innovation procurement, still the possibilities are quite important because it's not yet that known. Usually, I mean, our stakeholders are mainly research driven, less healthcare authorities. Therefore, it is really worth to invest yourself, because we do fund 100% pre-commercial procurements, public procurement of innovation 50%. It is a lot, so the support is huge. So it is really something that deserves to be more known, and I would be more than happy to organize a specific session, if you would wish, to provide more information about how it works, the kind of projects, examples that we have been funded, what they have delivered, what are their main struggles, because there are, of course, also. So don't hesitate to ask us. I have just included there a webinar session that can be useful. And yeah, basically, that is what I wanted to say. Sorry.
Thank you, Carmen. No matter, because it's important. I mean, most of the programs that are highlighting calls, they ask for the capitalization means. Where do they come from? Are they capitalizing projects from other programs? So that's something that it's more based, and Christopher it's saying yes. That's something that maybe further, when they start launching their calls, they can come back to us and say, yes, we launch a call with a specific requirement, or letting us know if you are replicating anything on Horizon 20 or something like that. So yes, we get to know, well, not us in Interact directly, but for sure all the programs, and we are responsible for this network. So a bit further on, we are able to provide you that kind of information. So and now we are happy to, and I left here on purpose some links, so the colleagues, Christopher, you would like to add something?
I just wanted to encourage Carmen in the knowledge that in this current programming period, and it's a very useful sort of tool for us, is that we were given, as Interreg programs, Interreg specific objectives to deal with, and I think there's like 6 of them, and one in particular that we at the Northern Periphery and Arctic program are taking is like encouraging institutional capacities for public authorities and stakeholders to work together. And I think the e-health area is a critical example that I'm hoping that our people later in the program will start to pick up on. And I think if there is the sharing of information, very good about projects, but my encouragement to you, Camilla, and your team and teams is to let the people that are assessing the projects know that they have to have a life afterwards. And the place to go is actually coming to Interreg programs such as mine and others, where we can take that information that's been generated in projects. So there's a transferability, there's a longevity now. It's going beyond being on a bookshelf and staying there. Great to know about all these things, but they can take some practicality out of knowing that there are issues not only cross-border but transnationally that can be dealt with. So I'd encourage you to share somehow with us, and at least with the project, approved projects, to know that once you've finished your work after however many years, there are other instruments and other programs, and that's us with our Interreg specific objectives, and eHealth fits right in there.
Exactly. This was the aim of inviting you, Carmen. We start with you, and probably afterwards we will start working with your projects. That was the reason to know what you have been financed already, because the programs can get some already ideas. But I think we can have afterwards another conversation. But I
think so. Yes, I think it would be very good.
For sure.